I'm going to have a discussion about the truth, right? Because the truth has been hidden from you in a lot of ways. So it's going to be a deep discussion, so I want you to pay attention of why I'm having the discussion, right? These are mass graves, right? We're going to pray for these people in Iran and the city of Qom, where these mass graves are being dug, and some lime here for these bodies to be thrown in a mass grave. The conversation, why I'm having this conversation with you now, is because it doesn't have to be this way at all. It doesn't have to happen in your community. It doesn't have to happen in my community. It doesn't have to happen anywhere in the world. It didn't have to happen in Iran either. So we're going to discuss exactly how to avoid that fate. Right? It's my responsibility as a person. I have a little bit of a following, and I have some information. I want to provide that in a time of crisis. I urge you to be a responsible person and do the same, because that's a big part of avoiding this fate. So let's figure out exactly how that happened. The government of Iran is an extremely corrupt government. They're liars, they're cheaters, they care nothing of anybody at all. And when this problem came about, they disregarded it and ignored it. And it got out of control. And it turned into this. How did it turn into this? How did it get out of control? As I've been discussing, as you might already know, the virus spreads through the air. It could infect a lot of people, right? So when it came time to heed the warnings of banning vast amounts of people gathering in places of worship and so on and so forth, they didn't do it. So let's talk about how the virus spreads one more time for people who don't know. Imagine if I was taking a pull of a cigarette right now, and I would exhale, and you would see the smoke out. And somebody would be able to smell the smoke somewhere else in this room. That's similar to what this virus would travel, how it travels, okay? That's why you have to have a protection of a mask. You have to have a protection from the mask, breathing it in, and you have to have the protection for others breathing it out. If everybody in the United States had a mask on now, this virus would not exhale and would not be able to cover everything and cover surfaces and get into your hair and get into your clothing, get into your eyes, right? But because people aren't doing what they're supposed to be doing and information isn't properly spreading, it's causing this type of problem. I'm going to do my part for my country, for my city, for my community to avoid this type of fate, which is absolutely avoidable, to make sure we don't spread the virus. Cover your face, okay? Number one priority in a room, right? We don't all have N95 masks, but if everyone's face is covered, we don't have to have an N95 mask, because no one is going to be exhaling the virus to begin with. It's going to get trapped right here. It's going to fall right away, right? It's going to diminish our chances of getting infected greatly. However, as you're well aware, there's a lot of people that don't believe in this or don't take the proper precautions, okay? In those cases, right, when you're around those types of people, you do want to have the proper protection and the N95 masks, goggles, raincoat, to make sure that the virus, you could be able to disinfect that raincoat, disinfected. So right now, right, my nose is a little itchy. If I disinfect my hand, within a minute, there's not going to be any virus on there if there was any. And I'm going to be able to happily touch my face without any issue. Okay? That's another aspect of it. Disinfectant, raincoat, goggles, mask. Now, N95 mask that filters this particular virus. Where can you get one? Probably not a lot of places at the moment. Perhaps your government's going to provide you with one soon. Okay? But in any case, use the resources that are available to you. Go to YouTube and find out how to make a makeshift one at home with household products. You might be able to pull it off, right? If I was the metaphor I'm going to give you is, if I was standing in the North Pole right now, this jacket would not protect me from the cold, but it would be better than standing there naked. So whatever you can to protect yourself from breathing it in and protect others from breathing it out, you do it, and we'd be able to stop the virus dead in its tracks. Disinfecting doorknobs, keyboards, so on and so forth. If every person in this country were able to do that, we would take leaps to avoid this type of fate. Now, how did they get to this? Let's go into a little bit more detail. It's back to numbers. 330 million people in this country. 60% are likely to get infected with this pandemic if we don't take the proper precautions. Out of those 60% of 330 million is 198 million. The virus has a roughly 3% death rate, right? 0.5% at a certain age group, 2% at another age group, 15% at another age group. But it also has some very random features. So if you think you're young and you're all good, that's not the case. You still got to protect yourself, still got to protect others, right? 3% death rate out of 198 million people. That's 6 million people that stand to die if nothing is done in the next 90 days. That's probably why your government is going to announce a quarantine within a week, tops. The sooner the better. Why aren't they doing it now? We'll talk about that. We'll talk about the economy. We'll talk about what's on your mind, your paycheck, your food, your family, all right? Every piece of information I have, I will provide to you. There's another number to keep in mind. Even more dangerous, 10% hospitalization rate. If in the next 90 days, 198 million people, out of 198 million people, 10% have to go to the hospital, that's going to be roughly 20 million people going to the hospital. Otherwise, treatable people that could be saved, if they're all going to go to the hospital at the same time, they're not going to be able to be saved. That's where the mass graves come from. That's why you have to take precaution. That's why you have to share information. That's why you have to take it upon yourself to deal with this problem. I know we're all upset about basketball games and Broadway shows and other things and our old life. I'm also upset. I was making a lot of custom jewelry, gold education, customers, so on and so forth. Now I have to deal with this, and so do you. So does your country. And it's time to step up and take up the role that you need to take to prevent this type of problem and the sadness and the suffering that is being experienced by the people of Iran. You can pray for them and pray for everybody else. If you want to spare the healthcare workers, take the precautions that I'm giving you. But don't just listen to me. Take the time out of your day to research more information. I'll give you a place where I got a lot of great information. Go to YouTube and search for Peak Prosperity. There's a guy there by the name of Chris Matterson, okay? He's a great dude, explains everything. He's going to give you more detail. Watch all of his videos. He's going to show you exactly how to protect yourself. I'm digesting this information. I'm providing it to you as quickly and as efficiently as I can in this video. But that's not enough. You have to do more. You are the frontline soldier in this war against this virus. Remember one thing that I want to communicate to you. The virus doesn't have a will. The virus doesn't care if you have your mask on or mask off, if it infects one person or a billion people. It's just a mechanism. You do have a will. You have control over what happens. You have to exercise that will. What you want to do. Laugh, pretend it's a joke, do nothing, not take it serious, or protect yourself and protect 20 million people and the healthcare workers that are going to be taking the brunt of this savage virus, giving them at least the proper protection so they could treat the people that are already going to be infected and already have to go to the hospital without adding an extra person there. Government officials, right? Let's talk about the government for a second. Iran, a terrible government. China, a terrible government. 80,000 cases, they say. They're lying. They stopped counting their cases at some point. They said, okay, we got up to 80,000. There was jumping by 20,000. They stopped counting. They just started quarantining, locking people in. All right? It's a terrible thing. They're lying. 3,000 deaths. There's probably over 50,000 deaths in China. If you're believing China, and you don't believe this, and you don't believe the news, but you're believing what China's telling you, you got to stop. You got to take a look at things in a different way. They're just not saying what it is. Right now, they're opening up Apple stores like everything is okay because their economy is being beaten down to death, and they don't care enough about their people. There's a lot of terrible things happening there. They're going to play out over here in a different way. We have a different population and a different government. I'm disappointed up to this point with the government. They're not telling you the truth. They're telling you to wash your hands. They're not telling you that the virus is airborne. That's not right. Okay? It leaves it up to me and you to spread the proper information. Take the time to tell people what it needs to be. Right? And over the course of the next 90 days, what can you expect? You're protecting yourself. You're learning how to protect your family. You're learning how to protect your gear. You're learning how to disinfect your hands, disinfect your shoes before you walk into your home, disinfect your raincoat. You're going to spend a lot of time indoors. And when you have to venture out for food and water, you have to get the proper protection. Research how to make a homemade mask if you have to. Okay? That's that aspect of it. Now comes the economy. You're going to ask yourself, how am I going to feed my family if I can't even go to work for 90 days? Never happened in the history of mankind.